Every year, millions of women around the world are diagnosed with changes to the cells on their cervix. This is called pre-cancer, and over 500,000 each year are diagnosed with cervical cancer. Both cervical cancer and pre-cancer are fully treatable. Medical Aid Films has produced this film to explain how pre-cancer cells and cervical cancer develops. It will also explain what you can do to protect yourself from disease by making healthy choices, attending cervical screening, and seeking treatment if necessary. Here's an expert on cervical cancer screening to tell us more.
Precancerous cells can develop at the opening to the womb. This is called the cervix and is also known as the neck of the womb. Cervical precancer is benign, which means it is not cancer, but if it is not treated, it can become cervical cancer. Cervical precancer and cervical cancer are caused by a virus called the human papillomavirus, or HPV. This is transmitted during sexual intercourse. Most women and men will be exposed to this virus, but only some women will go on to develop cervical precancer or cervical cancer. There are things you can do to prevent the precancer or cancer developing. Young girls can be vaccinated against HPV infection, and this will protect them so long as they are vaccinated before they start having sex. You can avoid smoking and being around those who smoke, as this increases the risk of developing many cancers. Most importantly, you can attend a screening which will help detect cervical precancer. If found, precancer can be easily treated, and this will reduce the risk of any cervical cancer developing later, and so could save your life. Most countries recommend screening between the ages of 30 and 49, as this is the best time to find early changes. In some countries, such as Uganda, screening starts earlier at the age of 25. Usually, you will be screened every 5 years, but if you are HIV positive, you should be screened every year because there is a higher risk of developing cervical cancer.
We spoke to some women after their cervical cancer screening. They told us some of the things they had learned from talking to their health worker.
I always thought that only women who had lots of partners could get this cancer, but now I know that anyone can get it.
I heard that women who didn't keep themselves clean got cancer. But the health worker told me it's untrue and it's caused by a virus called HPV. And HPV is not the same as HIV.
I learned that you can get the virus through sexual intercourse and that condoms can provide some protection. Men can have the virus but don't develop cervical cancer. Only women do.
Some of my friends think cancers are caused by witchcraft or covering your food with plastic. But I know it's not true, and that it's a virus that causes cervical cancer.
I got good advice from the health worker during my screening. I now understand how important it is for my health, and I'm happy I've been screened. Screening will save your life.
We're now going to hear from a health worker who's going to tell us more about what actually happens during the screening test.
Cervical cancer screening often takes place in a health clinic like this one, with a health worker like myself. We screen a lot of women and have treated many women successfully as a result. It is important that you come regularly for your screening, as it can help you prevent cervical cancer. There are 4 different tests that can be used to see if there are problems with your cervix. In all these tests, a small instrument called a speculum will be inserted into the vagina, and this allows us to see your cervix clearly. This may be a little bit uncomfortable, but it's a very quick procedure. I am going to tell you a little bit more about the 4 tests used. In the VIA test, which is also known as the vinegar test, a cotton swab soaked in vinegar is applied to the cervix. After 1 minute, the health worker looks at the cervix. If there are changes in the cells, white spots will be seen, which may indicate precancer. In the Vili test, iodine is applied to the cervix and will also change color if there are cell changes. Neither the vinegar nor the iodine will cause you to feel any pain or cause any damage to the cervix. Both the VIA and Vili are visual tests, which give the screening results instantly. If the results are positive, treatment is often available straight away. These tests are less accurate for women who have reached the menopause. The pap smear and the HPV DNA screening tests are also very effective. In both cases, a small sample of cells will be taken from the cervix and sent to the laboratory. This can take time, and you will need to follow up for your results with the health worker on your second visit. These are good tests for women who have reached the menopause, but they take more time as they require specialists to examine the samples.
So these are the 4 screening tests that could be available to you in your health clinic. But what happens after the results of the test comes back?
In most cases, test results are negative, meaning there are no changes to the cells in the cervix. However, it is still important to carry on screening every 5 years to make sure you don't develop precancerous cells in the cervix in the future. If you are found to have a positive result, or there is some concern about the cells on your cervix, then the health worker will want to treat this as soon as possible to stop any cancer developing. Remember, a positive result does not mean you have cancer. It means you have cells that might become cancerous if you are not treated. In some health clinics, we can offer women screening and treatment on the same day. This means you only have to make the trip to the health clinic once. A common therapy you might be offered is called cryotherapy. This removes any problem cells on the cervix by freezing them. The procedure is harmless and does not cause pain, and the cervix will heal within 4 weeks and return to normal. This treatment can cure most cases of precancer. It's important we see you again to make sure all the precancerous cells have been removed and to check that the cervix has healed. Not all changes on the cervix can be treated with cryotherapy. So you might be offered another treatment called LEAP or LETS. This involves removing the affected area from the cervix using a thin heated wire. This does not harm the womb, and the cervix will heal and return to normal. Sometimes we then send the tissue to a laboratory. This will tell us more about the stage of the precancer and whether any more treatment needs to be given.
Ndinalandirako chithandizo
I had the treatment where they freeze the area of the cervix. It felt funny but didn't hurt. I'm just relieved it's been done. I am now taking my daughters to be vaccinated against HPV.
My follow-up screening showed that there were no more problem cells. I think screening saved my life.
At the screening visit, sometimes the health worker will find that the cervix looks like it may have cancer. If this happens, we will refer you to a specialist who will take a small sample of tissue from the cervix to examine. If it is cancer, we will tell you where to go for further treatment and care.
Now, cervical cancer is a cancer that affects women, but it's important that men are involved in the treatment and prevention.
Men as well as women carry the HPV virus that causes cervical cancer, but only women can develop the cancer. The virus can be transmitted sexually. Young women are more likely to get the virus, and so sex at a young age should be avoided. Men can help their partners by supporting them to attend screening and treatment, by not smoking around them and making sure they eat a healthy diet. And of course, men can do the same themselves.
Men can also help by encouraging the women in their families to get screened and the girls to get vaccinated against HPV. We will hear again from our expert who explains how this works.
Vaccinating against HPV infection at a young age will significantly reduce the risk of cervical cancer developing. The vaccine is recommended for girls aged between 9 to 14 and before they become sexually active. Once they are sexually active, most girls will be exposed to HPV, so that is why it is important to vaccinate young girls before they are sexually active. Vaccination can take place at your local school or health clinic, and after the vaccination, the girls may be given an HPV vaccination card. The girl will be given either 2 or 3 doses, and she must complete the course for the vaccine to work. If your child is not available when they give the 2nd or 3rd doses, you should take your vaccination card to the nearest health clinic to ask where your child can get the next injection. The vaccination does not have side effects, and it will not affect the girl's fertility. The site of the injection may feel a little sore, and she may develop some fever. If other symptoms develop, go immediately to your nearest health clinic for further investigation.
Now we understand that cervical cancer is very preventable through screening and vaccination. If you do have a positive test result, there are some very effective treatments that will prevent the pre-cancer from turning into cancer. But remember, even if your screening comes back negative, it's important to continue to be screened every 5 years to make sure that any changes to the cervix are found early.